So welcome to Doctors Unscripted. So today I have Dr. Peter Nakaji on the podcast today. I want to have my phone for this one because he has quite a few titles. I want to make sure to get it right. So Dr. Nakaji is a neurosurgeon at Scottsdale Neurosurgery Specialists, but he's also a professor at the University of Arizona College of Medicine. He is the director of the Neurosurgery Residency Program at Banner University Medical Center, and up until recently you were also the chair of the and director of the Neuroscience Institute. Is that correct? Okay, yes. So just recently then you made the decision to go back into private practice, start seeing patients, opened up your own clinic. So let's talk about that kind of a transition for a moment. You've been in academia, you've been teaching, really leading edge, cutting edge technology, innovation, and then to go back to patient care and to take that leap. What's that been like?
I mean, it's been incredible, actually. It's been great. I think for most of us, the thing that got us into medicine in the first place is taking care of people. And that part I really love. I think for many people, there's a part of your career where you're sort of ready to slow down, especially if you do a lot of maybe difficult neurosurgery. It can be quite taxing, but I don't really feel like that at all. I really love operating. I love taking care of people. And I found that although I think I was pretty good at the administrative part, it wasn't where I was passionate. Mm-hmm. I really do like the rest of it. I like seeing progress. And the thing about being in private practice is very nimble. If something doesn't work right, I fix it that day. If a patient gives me feedback, I'll stop them and say, tell me about that, and literally change the process that day. And that's just something that's challenging for big organizations.
So, I mean, as a brain surgeon and someone who was really specialized in new and innovative technology, microsurgery and all of the most cutting edge stuff, do you feel like now that you've made this transition into private practice, you still have like the resources of a big institute when it comes to some of those innovative technologies?
So it is more challenging in some respects to mobilize some of those things, but others I'd say no, because really the thing that makes that happen is you. And it's your willingness to be open all the time and to engage things. And in some ways, although in order to make progress in big areas of research, you often need the resources of a big institution, the reality is that they're also a little bit stifling. It's, if you really want to be nimble and engaging new things, there are a lot of rules, which I'm not criticizing those rules, but if there are a lot of rules in process, that could mean that you want to have a conversation about something new, but compliance and law and administration and the budget you forecasted a year ago mean we can't do it for another year. Absolutely. And I'm not big on not solving the patient's problem today. I'd like to solve it today.
Well, I think that's a common theme in healthcare of doctors really caring about their patients, wanting to deliver the best care. Mm-hmm. And there are a lot of hurdles in healthcare. There's things that, from a regulatory point of view, there's things that we can't do that other industries can do very easily. Yes. And then there's also things like not just regulation, but also insurance. So we see that oftentimes insurance drives healthcare and the direction of healthcare and what procedures people are going to be offered. Mm-hmm. How do you feel like as a physician you've navigated that to be able to do what you feel is best in the best interest of the patient, but also you have to deal with this thing of how's it going to get paid for?
Yeah, it's something that, first of all, none of us have the luxury of pretending it doesn't exist. You simply have to know, and you have to be able to help the patient to navigate it. I think many people think if they join a big organization, someone else will figure it out. And I can just tell you, I firmly believe no one is coming. There's nobody better than you coming to solve that patient's problem, and that you have to get involved to some degree. Is that the main thing? No. But when it starts to perturb the care, it starts to distort the care because you have to do something a certain way, for a reason related to payment, I think you have to get out and advocate. And so, at least for me, I've been very willing throughout my career to talk to companies and say, look, this is a new thing. This is something they really need. This is the explanation. And frankly, once you get to that kind of peer review one-on-one, you usually can get it through. The trouble is it's very time-consuming, energy-consuming to do it.
I think that's like a big question that patients have and that can lead to a lot of frustration is, they go to their doctor, they're told that they need a certain procedure, and then they find out their insurance doesn't cover it. Yeah. And they're like, I'm paying for this insurance. The doctor says I need this care, and yet it's not covered. Why does that happen?
I think that insurance is one of these funny industries where arguably maybe there isn't any other industry where it might be better that it was had some fixed rate of return, like an interest rate, because otherwise there's too much incentive to not give you back the money you gave them, because essentially that's what it is. And there is this concept we tongue-in-cheek call insurance, which is you have insurance on paper, but it doesn't actually insure you against anything. I can understand why companies do it. They often are very motivated by not wanting to pay for things that really don't have evidence. And it's not clear because they only have so much money they can spend. And so I sympathize with that part. But I also would say that if we only paid for things that had today's evidence always, we'd be putting leeches on people. Yeah, that's the way progress happens, is by having a good rationale, pursuing it. And that doesn't mean it's experimental treatment. And sometimes it does mean it's experimental treatment, but frankly, society should be paying for that.
Yeah, I mean, like, experimental doesn't mean that it's not worth doing, doesn't mean it's not worth researching, doesn't mean it doesn't work. It just means that there's not enough evidence for them to put a payment policy in place.
Yeah, and again, is that the basis under which, if you're a person who has a healthcare problem that's really pressing, a neurologic degenerative disease that's relentless, a brain tumor of some kind, from your point of view, you want access to whatever treatment may help. Absolutely. And as long as it's rational, as long as there's sufficient evidence, you would like to have your own standard. And it's just, that's not the way society necessarily works here. But it doesn't mean it couldn't work that way.
I mean, I can imagine, as a brain surgeon you do a lot with cancers and tumors and other space-occupying lesions, like things in the brain. I think there's a lot of different things that we're seeing to advance treatment of cancer, treatment of those types of things. So in your space, how often does it come up that you find like a really promising area of research or a promising medication or surgery where it's not yet covered because it is so new? Is that something that you frequently see?
All the time now. All the time now. And the reason why it's coming is because the paradigm we were on before was, okay, here's something, there's a clinical trial, and here's an outcome, and now we've seen 1,000 patients got treated. And that works pretty well for the big cancers, breast cancer, lung cancer, some of the GI cancers. When you get to neurosurgery problems now, we're often doing gene expression profiling. Glioblastoma, one of the worst brain cancers, it's really 1,000 different cancers. Even if you sample the same tumor, you find different things all over.
Why is that?
Well, it just has to do with the way the genetics of glioblastoma is. It's not something like, you take a cancer like a leukemia, they can be very ferocious, but a lot of times there are only a few things wrong. Some lymphoma, the same way. There are certain brain tumors that are more like that. Glioblastoma is almost like a mutation factory, so that you get 1,000 different ones. Maybe you kill 999 with approach, but then that one springs into 50 new ones. So what we do instead now is we do gene expression profiling, which is basically like an individual thumbprint or fingerprint. And so we see that in that it says, yes, this tumor would be susceptible to this drug, but there's no clinical trial for 1,000 patients.
Wow.
But there's very strong evidence based upon what we know that specific tumor is doing. And that's just a way of thinking that insurance companies and even the government has not completely come around to yet.
I've seen a lot of things with like right to try and stuff like that of people wanting to try stuff, especially in cancer situations. Do you feel like those types of initiatives have been really helpful for the industry?
I think they're really a double-edged sword, because we do see things that are dangerous, things that really don't have that kind of rationale. So I do think that it's really important for us as practitioners to look for the rationale. Like, what is the evidence driving it? Does it make sense? Because we have seen cases in the past of people who got, for instance, stem cell treatments in other countries where that turned into a cancer instead. We see drugs that really do have terrible side effects given by people who only have that drug to sell, not 50 treatments, and this is the one they chose for you. And so I think that there's always something where we have to be very cautious. But I do think that regulation is better coming off from doctors. I mean, when medical professionals who are seeing you somehow can't win the PR war in convincing the patient they have their best interest at heart against spreadsheet-driven insurance companies, governmental regulators, executives from various organizations, I think we're missing something. We are actually in the best position to regulate ourselves and to try to judge what's what's best.
I mean, the doctor who can examine the patient is always going to be with the best data, and therefore in the best position to actually say what should be done. Insurance companies, I do think there's a lot of good people at insurance companies, but you pointed out a lot of the issues there. They do have to, pay based off a balance sheet and following policies and everything like that. But when they deny care, not because it's experimental or anything like that, but just because they believe it doesn't meet medical necessity. When they haven't examined the patient, they haven't seen the patient, they haven't looked at the patient's records necessarily. That can be incredibly frustrating as physicians because you're wanting to give this patient care. It should be covered. It's getting denied. I think the best way to deal with that is, as you said, if you can get peer-to-peer and you can talk to another provider on the other end, it's a lot easier to do that. But unfortunately, it takes a lot of time. And in today's world, time is one of the things that doctors are getting less and less of. As we see insurance reimbursement go down, a lot of doctors have compensated by seeing more patients. And when you do that, it becomes really hard to invest time in your patients. And I think that's so important that we do invest time in patients. How have you dealt with that challenge where you're still able to say, I'm going to invest the time in my patients to make sure they get the right care?
Well, one of the things about that, I think, is that's a real advantage of where I am, and it's a privilege to be able to do what I've done and step out, is that I can simply control the number of patients that I'm willing to see. So if I know that there's a whole bunch of time that isn't accounted for by most big organizations, like meaning if you are a primary care provider and you literally have 40 hours of clinic a week, you are going to be there for 60 hours. And I don't know that the patients always appreciate, I think they often do actually, that the amount of work it takes for you to see them is actually a great deal more than the amount of time that they spent with you.
Absolutely.
There's tons of reviewing things, and many of those things are not compensated. For me, I know that as an administrator, it was very difficult for me with a straight face to go to someone and say, you need to run a full schedule, quote, without any time for that, because it's completely implausible, right? You would have to come 2 hours early and stay 4 hours late every single day in order to do that, especially if you want to do it at the level where you really feel you've provided the best possible care.
So I do want to touch on that. So again, going from administrator into private practice again, you talked about the flexibility, that's nice, but what would you say is like your favorite thing about being back in that seat of seeing the patients and getting back into face-to-face practice?
I think the most fun part for me is that if I find a problem that I find really interesting that the patient has that I think I can solve, and sometimes they've already been to see literally dozens of other people, I can take as much time as I want to do that. I could literally make the decision, and many times it's not an economic decision. The being in private practice lets me decide, okay, I really would rather spend 2 hours on this one patient's problem and see if I can solve it. And other times I just tell people, look, there actually is someone who's more qualified. We briefly, before we started, talked about the fact I just do brain surgery. So people will call and say, I really want you to do my spine surgery. I just don't do it. So I just say that's something I don't do, but what I am interested in is something that you have, which I think is quite unique, and I'm going to chase that thing down. And if I have to call 10 other doctors and review more films and do things that make absolutely no sense, where an administrator would say, hey, you're not keeping up on your pace, I got no one to answer to but myself.
I think it's really cool that as doctors become more and more specialized, it becomes less ego-driven. From what I've seen, because it becomes like, this is my area, and if it's right adjacent, could I do it? Sure, but there's somebody else that's their specialty and they can handle it. And I see that it's really, really cool to be able to say, like, hey, for my area, like, I'm the best. But I also recognize, could I do these things really well? Sure. But I'm going to let other people who that's their specialty and they're the best. And when patients can get to that level of specialty, I think it's really, really cool, because that's where we see care really become very individual. The quality of that care can go way up because you're not dealing with a generalist at that point. You're dealing with someone who truly is a specialty of a subspecialty focused on things. So kind of want to shift that. A lot of people have never been to a brain surgeon, which is probably a good thing.
Probably a good thing.
But, someone who may be asking, like, what do brain surgeons do? So let's say somebody gets sent or referred to you as a brain surgeon. Where do you start? How do you determine, is this, a glioblastoma, or is this, some other type of space-occupying lesion? What's going on? Like, what's your process from greeting the patient to taking them through where you've diagnosed them?
So many times the patients who come had some kind of symptom, and then they show up somewhere else first. They show up at a neurologist's office, they show up primary care, they show up in an emergency department, and they get their problem identified, and they get a scan. Nowadays, modern neuroimaging is amazing, and you can have so much information coming in the door. So we often at least know a broad category of what we're going to be dealing with. And that makes it nice in the sense that we can expect to provide a certain amount of education for the patient based upon that. But otherwise, it really is the same old thing. It's sort of primary care writ small in terms of the subspecialty area. We meet the person and we say, okay, what are your symptoms? How did this? What's your personal story that led to this? Because in that context, the same tumor could mean a very different thing. But then we start looking and saying, okay, what is the thing we have? And some things we see are, quote, good, and some things are not as good, meaning we don't have great treatments for them, or the treatment is well established. We definitely have a neurosurgical treatment, but we know that it has a limit to what it can accomplish. And that's like the malignant brain tumor problem sometimes. That being said, I think there's never been a better time in human history. We really do have more things to offer than we have ever had. We have more kinds of treatments. And when I think about the things we deploy on an average surgery, it is so many, like to keep things safe. I think about the difference between somebody like in an old 1940s Jeep driving on the road compared to a modern, car with automatic braking and lane keeping and radar, LiDAR, sonar. And I do think that this is where we're at now. It's much safer. We can often offer patients quite a bit of hope.
So, you mentioned glioblastoma being one of the worst tumors. So, people hear brain tumor, they're going to probably think them all the same. But some brain tumors are worse than others. So can you kind of explain or walk through, someone's told the bad news that they have a brain tumor. What does that range look like? How do you tell whether it's, a bad one versus one that maybe is more treatable and has better outcomes? What's that process look like for somebody who maybe is scared to come in, they hear this news that they have that? Yeah. How does that work?
So the first thing you point out is a very important one. I think everyone has to recognize, which is about 20% of patients are terrified when they come to the medical environment anyway. And then when they come with something like this, I'll see people who I know they're not hearing a word I'm saying. And sometimes I even bring them back and say, let me talk to your family member. And often now we'll grab a phone and record something for them. Say, watch this when when the white haze goes out from your vision. But when you look at even glioblastoma, which is certainly one of the most aggressive brain cancers, now we do molecular profiling and sort of sort out all the different markers in them. And we know that some are much more aggressive than others. Some will respond to certain treatments more than others. That range, though, it's pretty aggressive. You can go online and look at it, but back in the old days when I started, and that was really true back into the 70s, people were making it, a little over a year to 2 years. Now, there's certainly that stretched out, but it's not years and years and years for many people. Some people it is. But it just shows you all the challenges we have. The one thing is definitely true is the more engaged you are and the more you use all these modern tools, the more it stretches out. And it's much less protocol after the first round. First round, we have a pretty clear idea what works the best. But then after that, I think there's a lot of stops to pull that are maybe not on a traditional playbook, or at least not on a menu that you could always say, we always do this.
Gotcha. Yeah. Well, let's talk through this for a moment. So there's all these new drugs, new surgeries, new processes for treating this, but also there's people that, are terrified to do chemotherapy or to do surgery on their brain and things like that, and they turn towards alternatives. I think there's certain alternatives that maybe have, some good theory behind them, and there's other ones that are pretty crazy. And so I'd love to maybe talk through some of those things. So one of the things that we hear about a lot for people that maybe are looking for alternatives is things that they can do to maybe limit the growth, slow the growth, stuff like that. And some areas where I've heard some good things, like fasting, for example. Whereas fasting can really help with the body's own processes, cytophage, and to actually break those down, decreasing sugar. Can you maybe talk about some of those things where there is some good evidence of saying it's not going to fix it, but these are things that, if you have it, you should avoid this, and this could be helpful. But could you talk through some of those versus what are things that maybe are not so good and people should avoid?
Well, so a couple of things. Starting at the beginning of what you said, chemotherapy for brain tumors right now, for instance, is often a pill, and for many patients, extremely well tolerated. So it's not what people imagined before, of being very, very sick and everything. And same thing with the radiation therapy. I'm not saying it's a picnic, but it's certainly not like it was at one point. We know exactly, or pretty well, what the right dosing is. And so people do, I think, better. And so when people aren't afraid, I think it's reasonable to talk all that through, of course, but I would say you should definitely do it. You should get over that fear, and family members should encourage their family members to get over that fear.
You should do what your doctor's recommending. That's generally a good thing across any specialty.
And it's better than it was. I mean, I think that when people have they imagine somebody who in their family 30 years ago had one of these courses and it was pretty miserable. It doesn't have to be as miserable as that. On the other side of it, though, I think you're absolutely right. I think there are a lot of things that we can tend to think of radiation chemotherapy and then not think about the rest of it. But in fact, there probably is a lot more we should be doing. One of the tricky things, we don't always know on who. So you brought up something which I feel that there are probably many patients should limit sugar when it comes to cancers. I think this idea was that if we feed you really well, you'll have the energy to fight the cancer. But frankly, the cancer is like a bad house guest. It's eaten more than you. And so there are many glioblastomas that seem to be defective of mitochondria. And if you kind of go back to your biology, you remember that the mitochondria break down all the fatty acid part. The first part, which is the glycolysis part, is the sugar breakdown. Yep. And if you don't give sugar to those tumors, they're hunting around for something to do. And we've seen at least anecdotal evidence that some of them don't metabolize as fast when they're just deprived of that sugar. It's very hard, though. If you've ever done a ketogenic diet or done hard fasting, it's not something that everybody feels they can do. Yeah. But I do think there's a lot of evidence, at least at a biochemical level, that this is probably a good thing to do.
Do you feel that the massive increase in sugar in our diet has contributed to the rise of or increase in cancers?
I'm cautious because proving it is a little bit difficult, but partly it's difficult to prove because so many people. I mean, it's effectively...
And the whole population is taking
it. There's almost nobody who is successfully avoiding some form of processed sugars. Yeah. And processed sugars are incredibly addictive. I mean, I think that there's someone who said, and I don't know if it's really true, that processed sugar is much more, or is as addictive as cocaine. The other white powder.
The other white powder.
Yeah, and I think that it's real, and white flour too.
Yep.
And there's nothing wrong with these things in small doses.
Yeah.
But I do think that there's a big tendency to get far too much of it, and that it's not very good for you. And it's funny, if you think about it as a doctor, you think, well, I mean, sugar is everywhere in your body. But there's so much evidence now that it's highly inflammatory. And you'd think, how could it be inflammatory? It's a very basic thing. There's plenty of evidence that it is. And that inflammation probably is bad for us in all kinds of ways. And if we think back 40,000 years, we were walking around primitive Earth and we frequently fasted for 16 hours. Whole seasons would go by where there was nothing with any sugar in it at all that you could get. Maybe you'd get it for a few weeks a year when something bloomed. So I don't think our bodies were designed for the degree of overfeeding.
And processed foods.
Right? And processed foods, obviously there was no such thing before.
Yeah, I think it's... whether you're talking about pain, whether you're talking about cancer, the importance of good diet and nutrition.
Yeah.
Like it's not going to solve all your problems, but if you're in a place where you're like, I want to be as healthy as possible, like you want to be out of pain, you want to avoid, like get your best chance to avoid cancer. I think one of the best things you can do is, diet, exercise, like eating well, getting good nutrition.
Yeah.
Like it's going to optimize your chances. It's not going to give you 100%, but you're going to be in a lot better place. So speaking on that, do you have any thoughts on, organic food versus non-organic and the roles that those play in, whether it goes to nutrition or glyphosates and all of those type of things as it pertains to cancer?
Well, as far as, I would say even beyond cancer and for brain health in general, I think you are not meant to have all these other things in there. All these other chemicals in it. They just perturb the environment. Even the antibiotics that kill a bunch of things, you're probably supposed to have some bacteria come in with your food. Yep. Maybe all of our allergies that we have now are related to the fact that we don't. And the same thing with everything else about your immune system. Maybe the reason why brain cancer is still rising, we're not fighting them very well because we're peppering our body with all kinds of things that the immune system doesn't like.
Absolutely.
So I wouldn't venture to say that I could say which organic thing is or isn't the thing, but in general, I would say the healthier the food, the less the chemicals, the better. And that's very likely to be true for neurodegenerative processes like Alzheimer's disease, Parkinson's disease, all of these other ones, where we do have a fear that environmental factors play a big
Absolutely.
role. Yeah, for sure. But yeah, I think clean is good. Clean and natural is good.
Clean, natural eating is generally going to be better. I agree with that. On that, you look at some of the other things that are pretty trendy right now. Peptides. One of the things that we talk about a lot or get questioned a lot about is like, what about all these GLP-1s, or what about these other types of peptides that are out there? And most of the time when we look at GLP-1s, the question that they're asking is about weight loss. And when it comes to people in pain, because that's what we deal with primarily, losing weight can oftentimes massively decrease pain. If you're overweight, that can put massive strain on your knees, your hips, low back pain, and so losing weight can be really helpful for treating the root cause of pain. However, what is the trade-off? And one of the things about peptides is they've now been proven to be extremely effective for weight loss, but they also have a lot of other benefits, but there also could be some potential other issues that we don't know about. So what are your thoughts on peptides, specifically like GLP-1s? There's a lot of growing evidence on its effect on the brain, potentially helping with Parkinson's, Alzheimer's. Some initial theories and evidence are coming out on those things. So what are your thoughts on those?
So this has been a tricky one because we don't really want to demonize people's, weight, because there are people who probably are right at different,
it's a good point.
Different set points.
Yep.
And so it's not specifically that. But I also would go back to just what we were talking about. We were never meant to have this much abundance. Yes. We just weren't meant to have this much access to foods, and particularly foods that are highly processed, highly sugary, that are so easy to eat. And it could be that this is something that allows us to set that set point to be adapted to this kind of environment of overabundance. I think that although it is true that as you lose weight, there's literally less stress on the joints and everything, you can calculate that. I think that it's actually the drop in the inflammation that comes with it. I really do think that's a big thing. I'll just tell you one funny anecdote is many years ago, I was doing, and I still often do, these long 10, 12-hour surgeries on these gigantic things. Other neurosurgeons call me and say, I got something for you, and I think, okay, great, block that day out. But it's great. I love doing that, but I used to get hungry, during the day. And so I was on a flight once and I was picking up one of these magazines talking about special forces going ketogenic because they could go for days without eating. And so for about 2 years, I was strictly ketogenic. And the one thing I noticed was back pain gone, knee pain gone, every pain gone. I was never hungry, and I was never in pain. I wasn't sore. And every now and then, I'll go with my family somewhere, Italy, and there's pasta and all these things, and I really enjoy it, and everything hurts.
Yep.
Everything hurts.
I absolutely think that's fascinating, because I do a 3-day fast about once a quarter.
Yep. And
you drink water, but you don't eat food. And the first day's really miserable.
Yeah.
Like for me at
Very
least,
tough.
the first day I'm like, I'm so hungry, but by day 2, I feel almost like that Limitless pill that's not like the movie.
Yep.
Like my brain works faster. I can think clearly. I don't have pain. I still work out and do everything, but I feel that it's almost like it's just something, it comes off of your brain and you're like set free. So I'm a big believer in fasting and believe that it can fix a lot of things, but it goes back to those processes of your body was partially designed not to eat constantly.
Yes.
Right? Like you were talking about, like actually not eating for a little bit can be healthy. You break down cells that are old and need to be broken down. And so those types of process where the body really rebuilds itself and cleans itself, I think a lot of people don't ever have that. And I think it's a really interesting theory to explore, to be able to say, is that one of the reasons that we're seeing some of these chronic illnesses, whether it's from inflammation or other stuff, is if your body never gets to do the cleanup and breakdown that it needs to stay healthy, don't be surprised when those cells continue to propagate unhealthily, and what does that cause? And maybe that is part of the cancer and stuff like that that's there.
Well, for sure, there was a whole time in history where you went to bed and you tried really hard not to go out again until it was light again. So for whole parts of the world, that would mean you'd every day fast for 14 hours, right? The light would go down, you'd huddle up with other people, and you just wouldn't pop up again until the morning came, unless you had to maybe run off to the bathroom. And so because of that, your body frequently went through these clean-out processes. I think that this is something that we are supposed to do. I was once in India, and I did a multi-day fast, and I found the same thing. By day 3, I started worrying that this was getting easier and easier. And by day 4, I started thinking, I wonder how long this could go on. And eventually I decided sort of consciously, I think I'm going to start eating again, because I didn't need to lose weight at the time, and I could definitely feel that it was just easy. Yeah. It was getting easier and easier. But I would say the same thing. You feel very much more mentally clear. And sometimes I think it gives you your frontal lobe back, that ability to not process. I think that having gone through those experiences traveling where you could not get food, I realized I don't think I actually had ever been hungry until I was in my mid-20s and I was traveling. Because up until then, hunger was the feeling there was now space in my stomach for more food. That's not the same thing as hunger. Hunger is when you're losing weight because you don't have enough nutrition. Yep. And that's a completely different experience. And I do think that to some degree, some of our diseases are driven by this excess. And probably GLP-1, other inhibitors like it, are going to have a place. I think you could easily go too far. Yep. With it. But finding that balance in between, I think, is good.
So let's go back to brain surgery for a moment. So
yes.
I think as far as brain surgery, there's a lot of new advancements. We're seeing really great tailwinds in the pain space, where we're seeing surgeries that used to be very big open surgeries, long recovery time, big chance of infection. Now we're able to go to these, whether it's microscopic surgery, microsurgery, minimally invasive surgery. We've seen that we're able to do it much more minimally invasive, less chance of infection, faster recovery. What are some of the coolest procedures that are really that cutting edge innovation as it comes to brain surgery?
Well, I think that there are a few examples. I mean, a lot of great examples, but the overall trend is what you said. We've gone from big, big, big to small, small, small as much as possible. So I like to, open the head and go inside and fix aneurysms. So like a bubble bursts in the brain, we go and we put a little clip on it and seal it off. But that's a big surgery. Now I can do that surgery often through a small opening in the eyebrow or a small opening here. So instead of this and everything, it can be a very small thing. But at the same time, now people are threading catheters. They can go in your wrist, they can go in your groin, go up to the brain, and do an amazing number of things through the catheter. So that means, again, no incision or small incision, fast recovery, those kinds of things. More and more tumors are treated with either advanced medicines or with things like stereotactic radiosurgery, where we're just beaming radiation that's focused like a magnifying glass, focusing the light of the sun. So not hitting everything, not losing your hair. And that's I think incredible technology. We can now insert a laser inside and melt things from the inside. And that means no ionizing radiation. So all the things that people worry about in terms of radiation is really just heat. And that has some amazing effects. In fact, sometimes we think it may drive some immune response against the thing you're melting too, because you're basically heat killing it and leaving it behind. The body comes to clean it up and says, "Hey, what is this I've got?" And then can go and attack the rest of the, of the cells that might still be left behind. So there are just a ton of things like that. Spine, gone from gigantic constructs now to a lot of more functional ones, disc replacements, percutaneous, just small incisions, drop a screw in. So I think that I think is a huge part of it. But then the other part is restoration. Yeah, I think we're going to see more and more things where we're implanting wires, chips, things that are bringing back function.
That's something we've seen with advancements in the neuromodulation technology, getting better and better, getting smaller.
Yep.
And as we get smaller, as battery technology gets better, as microchips get better, I do think that as great as it is to live right now when it comes to technology and procedures, I can only imagine with AI and some of the other stuff going on, the next 5 to 10 years, I think are going to be really incredible as it pertains to certain areas and specialties. How do you feel like AI is going to affect brain surgery and your specialty?
I think AI is going to be a big deal. So I'm hoping that one of the areas that will help with is simply by gathering data from lots and lots and lots of places faster than any human could ever hope for. It will lead us to insights that we aren't making now. And that's part of that is that rare disease area that I was talking about, where there aren't enough of us communicating well enough to see the insights that could lead to cures. There might be something right in front of us the AI can spot.
I want to just expand on that. So before we started the podcast, this was one of the things we were talking about, is that there's certain diseases that essentially it's really good to get research and data over large populations, but there's certain conditions, genetic conditions and others that it's a small population that have this, and it's really hard to gather the amount of data that you would need to make advancements in medicine and other things on that. And so one of the things you said is that AI and the modeling we can do off that can actually allow us to see it over larger populations than maybe we could in real life, and that could advance medication, treatments, and anything on that, right?
Right.
So how do you feel like, if you could speak to that specifically, how do you feel like AI, as it pertains to those rare diseases, can you extrapolate on that a little bit, how it can improve treatments?
Yeah, for sure. So one of the problems, if you have a condition that causes a very common symptom, like, if you think about if you have a disease that causes fever and cough, well, so many things cause fever and cough, that figuring out that there's one particular one that could be treated is very difficult. Same thing, a lot of times people have headache. 85% of Americans have headache at one time or another. Maybe you feel like your thinking is a little off. Well, telling the difference between very off and a little off cannot always be that easy to do. So if you have those vague symptoms, then the actual underlying thing may be hard to spot because it's hard to tell who's what. But an AI can look at, the medical record across, 40 health systems and pull all that and aggregate it and say, of the subset of people who have these symptoms, we notice that this is a group or that is a group that might respond, better or seems to be responding better. And it can then be a signal to do a more disciplined kind of study. And I think there are a whole bunch of insights like this that are going to come across many disease processes, but certainly within the brain. If there's an environmental factor driving something like Alzheimer's disease, Parkinson's disease, other neurodegenerative diseases, it's probably going to spot it before any human researcher is going to spot it. So I'm really looking forward to that piece of it, which is this ability to get the great insight, for sure. The next part of it will be looking through the data on treatment and saying, okay, here are the treatments we're trying, and we think we're seeing signal. We do meta-analyses now, but they're always as good as the worst study in the pot in some ways. And so you really want something that's going to do meta-analyses of meta-analyses and actually look at the underlying data and say, this is not really the best. But that takes some discipline for the machines to do. The other thing I think it will do is it's going to tell the people. I can tell you just many stories of patients who have come in far too late, but if somebody had put their symptoms into something, it would have immediately,
there is that question: will a computer be better at diagnosing someone than a doctor? And there is a question on that, and my thought process on that has always been, from a data perspective, probably, but from a hands-on perspective, I don't know if it will ever be as good, in the fact that being able to sit down with the patient, listen to the patient, ask the right questions, and move on from that. But again, who knows, with how technology advances, we could get there. One thing that I really like about AI, though, that you talked on, was sometimes we get so hyper-focused and our vision gets very tunnel, right? So, in practice, when we're treating pain, it's like I have back pain and it's like back pain, right? And you're looking at it and you're going to go, okay, like the brain. And we do hyper focus on those areas because it's our specialty, it's what we study, it's what we work on every day.
Right.
And one of the potentials that AI has is to actually zoom way out.
Absolutely.
And go, what about, okay, they're treating with this provider and this provider and this provider and this provider, and each of them has a piece of the puzzle. But if you can zoom out and see that whole puzzle, you can go, here's the common thread that you all haven't seen because you're looking at your space.
Right.
And I think that if we can start to get those types of more holistic views where it says you're seeing your primary care for this and your pain doctor for this and your neurosurgeon for this, you realize, your dietitian for this, like you could just keep adding onto that list.
Yeah.
When we simplify it down, you have this in common, and if we treat this, a lot of that will drop off.
Well, and for sure you see that with people who have probably the bad metabolics, right? The people who are too inflamed, then everything hurts. And so then the same stimulus, maybe you really do have a herniated disc, maybe you really do have a pinched nerve, but in that setting where everything hurts, it hurts even that much more. You only have to have a bad flu sometimes where everything hurts to know what that kind of feeling is, where everything is amplified. And I do think that this is going to be something that we're going to realize, quite a bit, is that the background is there, and that if you solve that underlying problem, that would help. The other thing is many times when I see patients, and I wish I really had more time to do it, and maybe in my new practice I'll be able to, is when I look at a patient's problem, the thing I want to ask them, and often at this point in my life, I am often asked to mentor physicians too, and that it's the same thing. Are you getting enough sleep? What is your diet like? How much do you get exercise? What are you doing for the main stable relationships in your life?
Yep.
If you got all those things, everything else,
you can work through it.
Everything else gets at least somewhat better. The problem is not always the same for everybody. I'm convinced that I have the DEC2 gene, which is the short sleeping gene. And my wife is always saying, this is not healthy. You need to get more sleep. And I just think I'm not staring at the ceiling between 3 and 5 a.m. By 3 o'clock in the morning, many days, I'm just wide awake. I feel perfectly rested. I don't feel tired during the day. But that isn't going to be true for most people. And there's probably something else where I think there probably are people who can eat a lot of sugar and not get as inflamed as me. But for me, I'm very sparing.
Well, genetics is amazing like that, and the fact that as our population grows, we see these different combinations of genetics from all over the world that create different profiles. They're going to express in different ways. They're going to react differently to different scenarios. Stress can bring out different gene expression. And so, it makes sense that people need different things. And that's one of the problems potentially with standardization. We've talked about this earlier as well. Standardization is amazing in the fact that there's certain things that we can say. If we want to try to guarantee results with the best ability possible, you have to have certain standards that you need to be able to meet, that you need to look at, or else how could you ever consistently and repeatably treat something, right? But at the same time, because people are so unique and they have this different gene expression, they have different makeups, different body makeups, compositions, different, bacterial compositions, that not everything is going to respond the same way. So how do we balance that as a medical society of having good standards that allow for quality care and also making sure that we're treating the individual?
Yeah, there's no question that standardization, protocols, guidelines that are consistent are the foundation on which customization has to occur. Otherwise, it's all random, and you just can't track it. I think it goes back to what you talked about, which is the idea of customized AI. It's the AI that can look at you and say, for you, which of these things should you be deploying? And what are the markers that we can look at? And it could be a large holistic marker, like, yes, now I feel like I'm sleeping better. Or it could be a very precise marker, like we just, measured your blood and here's some certain tests that seem to be, very off when you do this and they're better when you do that. So I do think that for both education and for your own life management, there will come a time, which is probably not very far from now, where there is intelligence optimizing your life. It's thinking about you, and it's not thinking about everybody. And I think that will probably be better.
I can see a day where in the not too distant future, there's a company that says, give us your blood lab. We're going to run a full series of everything. We're going to look at the genetics. We're going to look at everything. And then it's going to come back with recommendations. And it's going to say, based off of your gene types and based off of this, blood labs, here's some things that you would want to consider. Like people that have this gene expression tend to sleep between this hour and this hour is optimally, and tend to do well on this type of diet, and tend to do well in this. And it's like almost getting these personal recommendations off your genetic code where you could say, maybe not all of these are right, but it's saying, here are the averages, and look at these and try them and say, hey, I tried that. It really worked. I tried this, it didn't. But I mean, you can imagine that if you did that, the quality of life for the majority of people could potentially improve dramatically.
Yeah, it's a real challenging. It actually brings me to mind an interesting neurologic topic we could talk about as far as technology goes, which is okay. So we do this, and you stand in front of a mirror. Actually, maybe it even doesn't draw blood. It takes a cheek swab. It whatever. You go to the bathroom, and it measures that. It takes your sleep data from the night before, all those things, and it says you need to go do this thing. You need to go do 50 push-ups and 10 deep knee bends, and you need to deep breathe, and then you need to do a cold plunge, and all these things. And I think to myself sometimes, like when I watch the Uber driver, and there's literally a computer telling him what to do. So who works for who, right? Now we're working for the machine. And every time my Apple Watch reminds me to breathe, I think, I'm pretty sure I'm breathing, If I get to the point I need to, but I know what they're saying. It would be better to stop and take those deep, mindful breaths. Yeah, I think that this is a really interesting question. It's like, what happens when we are implanting chips into people and they're making sure you do the right thing?
You're living to optimize instead of living for life.
Yeah, optimizing. I mean, I just imagine what an existentialist philosopher would say about you living to optimize what some Silicon Valley company has decided is the best possible life.
It gets scary. Like,
very.
Because we were just talking about the two sides of this, which has been a really fascinating conversation, from going back to the basics of fasting and eating healthy and how our bodies are made to do that, to the extreme other end, which is how technology could optimize your life and whether that's a good thing or a bad thing. And I think that it's probably somewhere in between. Like for me, I wouldn't mind getting healthcare recommendations that are much more customized to me, but I wouldn't do it to necessarily optimize some type of algorithm. I'd want to do it based off of optimizing how I feel. Right, and being able to say, what, if I feel good, I'm gonna continue to do that. Fasting, I feel great when I'm doing it, so I continue to do it. I don't do it because of anything except for the fact that I feel like it's good for me and I feel good afterwards.
So what happens if you feel good and all the tests say that it's not good? Who gets to choose?
Who gets to choose on that? I mean, in the end, ultimately we do have agency and we have to choose. So you can choose to follow it or not to. But it's an interesting philosophical question that I don't have the answer to.
Yeah, imagine it's 2075 and your grandkids live in a world in which they go out in the morning and this thing is analyzing them, and when they go to the refrigerator, the thing that Amazon Instant delivered in for their breakfast that morning is only that's their choice. That's the only thing in the refrigerator, so that they won't have anything else. There's no risk of you having a temptation to eat the wrong thing. There's no risk of getting too much guacamole, because the little lid detects your metabolism and it slides shut over the top, so you can't get to it.
I mean, the nanny state in that type of a setting, for the sake of health and optimization, is scary. I mean, it's a controversial topic, but we looked at this in the COVID era, right? Of this is people saying this is what's in the best interest of society, and other people saying I should be able to choose what I do with my body. And I think that when we look at healthcare is one of those spaces where sometimes that line can blur of like, I don't want to do this, I'm being told I should do this, what do I decide to do? What is your thought process on that, of you're in a situation where it's all of the data, all of the science says you should do one thing, but as a person, not as a doctor, but you feel like you should do something else. How would you handle that?
Well, I think for all of us, spending more time being mindful and really thinking about what is it that matters to me, what are my values. I don't think we spend much time preparing for life. We really don't. And becoming more and more, self-actualized is a little too bit of a floofy kind of word. But the more you really understand yourself, I do think it can make you make better decisions. I see a lot of people who come in and they have a neurosurgical diagnosis, which is a challenge, and it's amazingly clarifying for them. Meaning a lot of the things that seemed important fall away. And I think we would all do better if we had those moments.
How often does that happen, where people come in and they're like, I need to go to work, I need to do this. They get a diagnosis from you and it's like, family's what's important. Work doesn't matter. Does that happen a lot?
All the time. All the time, because suddenly, I mean, it's always true, right? Literally at this moment, a meteor could come crashing through the roof here and take us both out. But we don't ever live our lives that way. And sometimes when you have something, I remember many, many years ago, I had someone who was a government worker, great job, everything. And she had a new diagnosis of a brain tumor, and it was a bad tumor, but it turned out to be the slow-growing variety of that. And so she started out believing that maybe she had a year and a half to live, and then actually ended up with more time. And she wrote me a letter later saying it was the best thing that ever happened to her. She straightened out her relationship with her husband. They traveled and did a bunch of things that each of them finally came out and said what they had been waiting to say, apparently for a long time.
Wow.
Because there was no point in waiting anymore, because it seemed like time was running away. And then life blessed them in a way. It's strange to think that you could go from thinking you had your whole life ahead of you to having, say, 5 to 7 years to live. But if you thought you only had a year, suddenly that 5 to 7 years seems like a long time.
Yeah.
And she wrote a very poignant letter back just saying that it was very, very helpful, actually, to have this happen. I mean, that's really seeing the silver lining where you might not otherwise do so. But I don't know. Life is a challenge. It's not an easy thing. Brain surgery is one of those things that when you come up against it, it does bring everything. And there's not a whole lot of challenge you can have in your life that's going to seem like a bigger deal.
Yeah.
And when people walk into my clinic, I try to be very welcoming, and very warm about that, because I think at that point you need a friend to some degree. I mean, you need somebody who's really, really good at what they do, but also look at you as an individual. Maybe your goal is different than someone else's goal.
I love that, and you could put it almost as in a saying, which is, one of the biggest blessings of challenges is the change of perspective that comes with it.
Yep, for sure.
I feel like for me, the places where I've grown the most have been not in the easy times, but in the times when I've come up against huge challenges.
Yep,
and when you reflect back on that, it's the change in perspective of, I thought there's no way I could do this, and I did it.
Right.
Or, it made me remember what was important, or it made me just remember to walk out and feel grateful for the day. And I'd imagine that seeing that as a brain surgeon, specifically as it pertains to cancer, in your patients over and over again has probably given you a different perspective on life as well.
Oh, for sure. For sure. It's just constantly a reminder of what's really important. And it, to my mind, it gives you that perspective that why waste time on things that aren't helpful? Really focus on the things that are helpful. And for me, I think always about how can we advance the field? How can we make things better? So if I leave tomorrow, what did I do?
Yeah.
And I just say, look, if I just look and say every day and every action, if I do what I think I would be proud of looking back on it, then probably it's going to be okay. It doesn't always work, because you try things and they fail all the time, but you're not worried because you were trying.
Yeah.
And you're learning.
And that's really, in my opinion, that's what life is about.
Yeah.
Right. And if you change that perspective of life's about learning instead of life's about accomplishment, you can be grateful in the highs and the lows, because you say, I'm still learning.
Yeah, because you can't guarantee accomplishment.
Yeah.
Right? And in fact, conflict of interest alert, I started a company, an Arizona company, that's a brain tumor killing product. And I think it's a great thing. And it's been working much better than I ever thought. Someday, could be 10 years, could be 20 years, could be 30 years, could be 40 years. Someday it will be completely superseded, right? The person who had the greatest saddle for horses, for the Pony Express, could never hope to compete with a jet airplane that came later to deliver the mail.
Absolutely.
But the fact is, it didn't mean that wasn't an important step. So as long as we look in our lives and say, what can I do right now today? Because the question is always a fun one, like the Zen teacher will ask you, is where would be the best place to start right now? And you're like, well, if I was going to start a business, it would be $1 million. If I was going to be in a relationship, it would be with a person like this. The best place to start is wherever you actually are right now. It's where you are right now, because you can't be anywhere else. All the rest of it is fluff and nonsense.
Yep.
So,
It's a fantastic point. You did bring up something that I am curious to hear about. So you said you started a company that kills brain tumors. Like, what's that process look like of being able to design and create something that really fills a need? Your client now is maybe other companies or other clinics and stuff like that, rather than just patients. What's that process of like designing that, starting that, and growing that?
Yeah, I think for physicians, this is something that I've gotten to teach some of this, and now it's gotten very trendy to talk about innovation and all that, but I think of it much more as find a problem that is not currently solved. this, particularly a friend who was a radiation oncologist, we were sitting around and we were trying to have that every patient would have another option. And when we were doing that, we kept coming to dead ends on certain things. And we said, okay, what is something that would meet lots of these dead ends? And eventually we determined a specific way to deliver radiation implanted at surgery that would be able to do that. And then there was a lot to figure out, because you think, okay, this is a great idea, but there's a lot of technical innovation that has to occur to get to something where you can put something in someone's head. It was a very multi-year process. I think we're about 15 years since we started doing it.
Wow.
It took probably 9 of those years just to get to the FDA point. In case anybody's thinking about doing it, it's pretty much like taking bundles of cash and burning them in a barbecue. It's very expensive. I often joke that my wife would say, can't you just like collect Italian sports cars or something like that instead? But no, she's extremely supportive of the whole thing. But it is a great pleasure to look at something and say, hey, this is something that didn't exist, now it does. And for me, every day that another person, at least the data says they lived another year longer, I think of that as a bigger contribution. I mean, if thousands of people live another year, that's millennia of life that have been extended. And that's a great privilege. At the same time, though, I don't think you can be so in love with what you do, because you really want to get to the next advance. And if it turns out that it didn't work, okay, we move on to the next thing and try. And if it turns out that it's superseded by something better, I just think, well, okay, it's time. Right now, it's probably in its golden period, where I suspect that in the next 20 years, it will have a place as a treatment. But it won't be forever. And that's really okay, because my real goal isn't actually just the company. It's that, and I think the people at the company feel the same way. The real goal is to make people live longer and have more hope and options.
Yep. You reminded me of a saying that says that success is the enemy of innovation. And it's in part in the fact that when you are successful, why would you look for, the wheel when you make the best saddles, to what you brought up earlier, right? And so when you're solving a problem, you're solving it really well. Well, why would we innovate to create something else when we're so successful in this? And so I love that idea that it's okay that we created something great and something else better may come out one day, because we're saving lives and we're doing it specifically for the right reasons. So I really admire the fact that you guys are not only innovating, but you're doing it in a way where it's geared and structured towards saving lives. It's pretty awesome.
Yeah, if the problem you're solving for is better life for humans, then it's easy to move on to the next thing when the time comes, because that's what you're solving for. And there's really nothing more satisfying, than that. And so that way, so this is how I feel. I've been very fortunate to innovate a fair amount in surgical procedures and everything. But whenever I go and I meet someone, I really want to know what they're doing. I don't want to tell them what I end up spending a lot of time, more time than I like telling other people what I do. But I really like to hear what they're doing, because it's very frequent that I will look and say, that's a great idea. Like, I could do that. And then my only goal is that if you teach me to do something new, my internal goal, which is a little vain, is to be a lot better than you at it pretty soon. That's it. If I put myself to that goal.
So you're not a competitive person
not at all, not at all. But I just figure if I think of it that way, which is I'm totally open to, learning it from you. And actually, I have no problem giving credit to every person who's taught me. We all stand on the shoulders of giants. Yeah. It's ridiculous to think that you don't. But if you just think, okay, let's make what I call virtuous competition. I feel the same way about healthcare in general. If I push for a better, faster patient experience, it's faster, it's better, the people are more educated, it will force other healthcare systems to do the same thing. Yeah. So instead of creating a leverage in which I don't have to be better because I have so much market or because of some other thing, I want to create one in which it's super transparent, it's super forward to the patient. That way it forces me to be better, forces somebody who maybe was thinking, well, I don't see why I should have to go and get more continuing education, thinking, I better stay up with the field because I won't be able to keep, competitive. Yeah. And that's great. Everybody wins.
No, I love that. I feel like when you set aside ego, you can truly unleash greatness. Yeah. Because at that point in time, you're free to learn.
Yeah, and learning all the time. There's a Zen concept, Shoshin, the beginner's mind. And it is like being like a child. Yeah. Like, I don't care if you think, like, I can't believe he doesn't know that. But if I didn't know it, then it's better to learn now. There's no point in not knowing it
Absolutely.
tomorrow. So I think it's very fun. And this is where, again, I think I probably like these rare diseases because you're getting puzzles that haven't been solved.
Mm-hmm.
There's no point in solving a puzzle that's been solved so many times, right?
Yeah.
You want to go and solve the new puzzle.
It takes a special type of person to do that, though, because you have to be okay with getting frustrated.
Yeah,
right?
yeah.
Because the people that are addicted to success are going to say, I like to do this because I'm good at it.
Yeah.
Versus what you're saying is, I like to do this because I struggle and it's hard and I get to figure it out.
Yeah.
And I think that and both people are important to have in medicine.
Yeah,
But
true.
if you're going to have innovation and you're going to really push forward advancement, you have to be okay with failure.
Yeah, I think that's so for the people who are interested in that kind of advancing the field piece, you have to be. Because if you're not, you will have a temptation to find one thing, like you say, and stick with it forever, even past the point where it may not make sense. Or you become a hammer looking for nails, and you're always trying to apply your solution to the same thing. But I think if you're looking at it in terms of just wanting to make progress, you'll always be looking for the new thing. That being said, I do think it's also important to realize for all of us that there's every kind of person.
Yes.
So the people and also people in different seasons of their life. Like if you're at a certain part of your life as a doctor and you really, what you have to give is to show up and do a good job for your patients and go home at the end of the day, that actually could be okay.
Yep.
I think there are show horses and workhorses, and everything, the show horses always think that the workhorses aren't showy enough, and the workhorses think the show horses all show, but really you need both kinds of person, and probably there are 1,000 gradations
Absolutely.
in between.
So in the spirit of innovation, one of the questions, while this is unscripted, one of the things that I'd love to ask is about the opioid epidemic. And so this is obviously dear to our heart as we treat people in pain. But I think that when you collaborate with people from different specialties and you get that, second pair of eyes looking in, you can often find ways to solve problems that maybe never occurred to you. So one of the things that I love to use this platform for is to be able to ask the question of, how do we solve the opioid epidemic? And I'd love to hear your thoughts on, what are some things you feel like, as a medical society, what can we do to help solve this?
Well, one thing I think was we can be very conscious and aware of the problem, for sure. I'm intrigued by the idea that it is a brain chemistry problem at some level. But we may not be always thinking about it the right way. This sort of well-discussed phenomenon that during Vietnam people came back as heroin, addicts, but very few of them stayed it once they got out of that environment. You got out of an environment where people are trying to shoot you all the time, you think you may be dead, and you're seeking this instant pleasure, and where other people are doing it, suddenly it goes away. And so, how much of this is being driven by being in a place of hopelessness? Like if you don't think your pain is ever going to get solved, why wouldn't you go to this? But if you think your pain is going to get solved, then you think, well, I don't know if I really want to be stuck on these medicines, maybe I will try something else. So creating that supportive environment, and thinking about how do we do that part? Are we really solving? Again, and we don't talk about that. We don't talk about, well, are you getting enough sleep? Well, without the sleep, then you are in pain more, or your willpower is less. Are you eating right? Again, you have that inflammation. Maybe your pain medicine need is that much higher. All the basics. And then the relationships. I think thinking about how you get people in a better place, mental health-wise, is a big part of it. I do think that, at least my small personal experience with mindfulness and meditation is that's incredibly powerful. But it isn't true that you can just watch a YouTube video and sit down and 10 minutes later you can master your pain by thinking it out.
And you're out of pain.
Not at all. It's a huge amount of work. I do wonder though whether, again, back to the brain chemistry thing, whether there will come a time where there's a medicine you can take, and with the medicine and the practice, right? If you took steroids, anabolic steroids, and didn't work out, you wouldn't get the same kind of effect as if you did both. Probably there's something where we change the environment and we do, this kind of thing. Certainly, the area where that's being explored right now, which is very interesting from a brain chemistry standpoint, is this whole area of psychiatry and using certain hallucinogenic pharmaceuticals, which it's not so much they're hallucinogenic, but they kind of take the brakes off of the change and make you open to change. But again, same thing. If you, quote, go on a bad trip, it's that the experience you had while you let the brakes off was you drove off a cliff instead of getting back on the road. Yeah. And probably for all of us, we have to start thinking, okay, now we did the thing. Perhaps somebody is in, say, pain from a back problem, and now we've just done a big surgery. But if we don't do the rehab, if we don't get them to control their weight, if we don't do all these other things, sooner or later they're just going to be back in the operating room again.
Yep, absolutely true.
Yeah.
I really like the concept that's been almost thematic for this podcast of, on advanced hard topics, sometimes going back to the basics can solve a lot of the underlying issue. Maybe not everything, but it can solve a lot of it. And so, sure. Sleep, nutrition, relationships, right? And I think that sleep, nutrition, relationships,
and exercise.
And exercise.
Exercise,
like that needs to be in there.
The wealth
of
sins.
Four pillars, right?
Yep.
But like how many different issues in our healthcare system? We have the most expensive healthcare system in the world.
Yeah.
How many things would be solved by that? Like you look at type 2 diabetes. Again, nutrition, exercise would be important.
Yep.
Relationships to be able to sustain you and support you in that.
Yep.
Sleep, which again, willpower and everything else. Like you look at, pick your condition, and the fact is that almost any condition can be improved by those four basic things if you're doing it well and you're working on it. So I love that as a concept for applying it to the opioid epidemic, but I also love it as a concept to applying it in general in life. And I feel like in the modern day of science, technology, that oftentimes we think that we just need to wait for the next novel thing that will finally solve the problem.
Right.
But in the end, if we do our part, a lot of those things are not going to be needed. And I think that's a great thought process.
And certainly they create a background. And it could be that you aren't going to cure your cancer without addressing whatever this factor is. But in the setting in which you get all those other things right, life is certainly going to be better, and probably the thing that you do will work better, have a more lasting effect. Yeah, there's no question. I mean, as much as I love geeking out on the very nerdy details of the science of, brain tumors and their genetics and their biochemistry and all these other things, a lot of it does come back to the essentials. And again, we can never lose track of that we're treating people, and then sometimes it is those things that we're talking about that are so fundamental that we're trying to get people back to. There's no point in me putting you through a treatment that leaves you miserable for the time you have remaining, or where it puts a huge amount of stress on your family or all these other things. And so if we start thinking of it much, much more broadly in terms of what we're trying to, again, what's the problem we're trying to solve? Yeah. And if we're trying to solve for a better life, then it's a very different thing. And again, yeah, I think it's just so easy for us to not address the things that are right in front of us. We're very good at skipping right over those things. Absolutely.
So, as we wind this interview down, one of the things I would love to do is give you the chance to speak to those patients that we talked about, people that need to come and see a brain surgeon, that whether it's for cancer, an aneurysm, whatever it may be, that a lot of them may be stuck in fear. They're scared to take action. They're scared in the fact that there's the unknown. What advice would you have for somebody that's maybe contemplating coming in? They've been maybe recommended to go see that, but they're hesitating. They're not wanting to go. What advice would you give to them as it pertains to coming and seeing you?
Yeah, I think if people have a verified problem, it is always better the sooner you get to it. It's always, I recently saw somebody who had a relatively small, probably benign tumor, and it's so tempting just to say, well, we'll push off treatment for a year and another year. And sometimes that's appropriate, but once we see the thing is growing, it's only going to get more difficult. Yep. It's just going to get more difficult. And that being said, all of us are good at procrastinating. And sometimes you do have to draft somebody else to say, hey, I want you to hold me accountable to this and make sure I make it to this appointment. Sometimes you have to just go and get a little more familiar, so it's not so much the unknown. But it's remarkable how many times I see people who think that they're terrified dig down and be resilient. I think very much of a young lady who had a brain tumor in a very critical part of her speech area, and I could think of nobody who thought that of herself she could never stay awake for brain surgery so that we could test her language as we removed the tumor. She flew through. She flew through with a lot of coaching, a lot of thinking, a lot of support, but in the end stayed wide awake right through the thing. And finally, at the end of the removal of the tumor, I said, you can go to sleep now if you want. She said, I think I'll just hang out. And she chatted away through the rest of the surgery. Wow. Everything was numbed up, so it didn't hurt, and she was able to get through that. So I think we have a lot of resilience in ourselves that we don't realize. But I think it's often it's a kind of 12-step thing. You have to realize, yes, I have a fear. Okay, I'm acknowledging that. Okay, yes, I'm going to get help from somebody else. Yes, I'm going to find accountability. Yes, I'm going to do all these other things. And the other thing that often really helps people who are afraid is, I tell them, tell me something about somebody in your life you care about, right? And well, my granddaughter's amazing. I said, I think she wants you to be there, right? When she graduates. So maybe you could go ahead and get this thing treated, right? And then she's like, yeah, I wouldn't do it for me, but I'll do it for her. So we're often really good at that, doing it when we're too afraid for ourselves. That same person will rush into a burning building for someone else.
Yeah. So going back to the relationships being so important in our lives. So again, for anybody that is, in that situation, they're scared, they maybe have lost hope. It's a matter of rally your relationships around you, have courage, take action. Life will be better by taking action than by
by just sitting.
Yeah. Well, thank you so much for taking time to come in for Doctors Unscripted. It's been an absolutely amazing conversation. I've really enjoyed it.
I really enjoyed it. Really pleasant.
Well, thank you so much. And with that, we'll go ahead and end the episode. So thanks, everyone.
Thank you.